The struggle for health continues. Hi, my name is Payman and I'm a preventive and social medicine specialist and a professor at Tehran University of Medical Sciences. In this channel, I'm gonna summarize a recently published paper from the Lancet Journals. You know that in previous videos we spoke about some topics including child poverty, drug decriminalization, machines and empathy, and for today I've selected a specific paper called a luta continua, the struggle for health continues. It was published in the Lancet on December 2nd and its issue number is 10417. The type of paper is perspective and the article is about a book. You know that a luta continua is a Portuguese statement, means struggle continues. And here we have it in the title of the paper, and the author says the struggle for health continues. The author of the paper is Marytbasset, who is an American physician and a public health researcher, and from 2014 to 2018 she was the commissioner of the New York City Department of Health and Mental Hygiene. The paper starts with the following sentence. In 1985, davidsanders published the first edition of the Struggle for Health, completing it in his native Harare, Zimbabwe, which had gained its independence 5 years earlier. You know that Sanders was born in Zimbabwe and unfortunately he passed away a couple of years ago, and as a result 2 of his colleagues finalized the second edition of the book called The Struggle for Health, Medicine and the Politics of Underdevelopment. This new edition is going to review the past decades of healthcare systems of Zimbabwe and some other underdeveloped countries. The main message of the book is the following, as it was mentioned in the introduction of the book. Improvement in health will come largely through political change rather than through pills and injections. The author of the article says, 40 years ago, iansmith, who was the Prime Minister of Rhodesia, previous name of Zimbabwe, was overthrown from the power. iansmith had a colonial regime and the people of Zimbabwe didn't like him. But now the people's health is more frightening than before. Indeed, the authors of the second book is going to explain why Zimbabwe's healthcare system had a rise and then a fall in its function. To be more precise, WHO and UNICEF composed jointly the 1978 Declaration of Almata, and most countries approved and signed it. The document called for urgent and effective national and international action to develop and implement primary health care throughout the world, and particularly in developing countries, in a spirit of technical cooperation and in keeping with a new international economic order. Primary healthcare here has a social concept, and it's not limited to personal medical services, and it relies on community personnel. About 40 years ago, Zimbabwe framed its healthcare system based on Alma-Ata's declaration and got many health advances. For example, the infant mortality rate declined dramatically in the country. However, in recent years, the government dismissed the Alma-Ata declaration and market was prioritized in policy making. In fact, what caused the first and second editions of this book so important is the Sanders' focus on health inequities. Moreover, Sanders wants health workers to understand that political processes generate health inequities. In the second edition, Sanders and his colleagues show that the world has changed noticeably and how neoliberalism drove commercialization on health, such as intellectual property, protection of pharmaceutical profits, unsustainable food systems and ultra-processed foods, and the fragmentation of the global funding architecture. Sanders devoted his final years to people's health movement, and the author says, Sanders is now gone, but in this book and in the work of the movement can be found the critical analysis, courage, and facts needed to stand up and speak truth to power. Happily, the book is free access and you can find and download it from Oxford Academic website. Many thanks for your attention. If you are interested, please like it and subscribe to this channel. In this channel, I'm gonna summarize a recently published paper from the Lancet Journals. Please send your comments to me. Many thanks.